Hi, everyone. Thank you for joining the community update today. I am Angela Cimental. I am Acting Communication Manager for Boulder County Public Health. Today, we're going to hear from Jeff Sayak, who is our Executive Director for Boulder County Public Health. He is going to be speaking about the latest data. We will also get a vaccine update from Chris Campbell, our Emergency Manager. And after the presentations, we will answer your questions. Mike, back to you.
Thank you, Angela. A few housekeeping items here to let you know how things will be going today. We will be taking questions at the end of the update. You can use the Q&A function at the bottom of the screen to do that. And type your questions there. We'll read them out for you. If you're on the phone, you can hit *9 to raise your hand. We'll call on you and you can ask your own questions. We ask that you please keep your questions short and succinct so that we can get to as many as possible. And now I will turn things over to Jeff Zayak, Executive Director of Boulder County Public Health. Jeff.
Thank you, Mike, and hi, everyone. It's good to have everyone back again. Very excited to be presenting data to you today. The data looks good. We are headed in the right direction, as was the case the last time I presented. But I do want to make sure I'm emphasizing a few things that I'll show you today. And it's going to be really important, especially as we move forward, to not let up on some of these prevention strategies, and I'll show you why. So I'm going to share my screen here and we'll get to the data. Hopefully everybody can see that. And I'll walk us through the data here. Just a few key messages up front, and I'll show you the reproductive number. It's less than 1. That means if it's less than 1, that we have infections declining rather than increasing. So I'll show you that. Our transmission control is at 83%, which is great. That is exactly where we need to keep our transmission control at, and I'll show you why that's so important. As you'll hear me say over and over, transmission control is really the key measure to help us make sure that we don't move into another surge as vaccines are getting out into our community. Our infection prevalence has declined again. It's 1 in 238 people who are infectious. That's still a lot higher than where we were in the summer. But if we keep on the trajectory that we're on, we're going to be heading towards that summer number fairly quickly, which I'll show you in a little bit. And our cases, hospitalizations, and deaths are continuing to decline, but the rate has slowed a little bit. We are at yellow on our county dial, and these are our 3 indicators. Our incidence is 114.3 per 100,000 people over a 7-day period. Our average positivity is 2.8, and we have 9 days of declining or stable hospitalizations. This is the Metro Denver data, and as you can see, it's been on a decline. We have a little bit of tailing here and a little bit of flattening, so want to make sure that continues to go down, and that's going to depend on making sure we're doing things like wearing masks and social distancing. Our data, 7-day average for Boulder County looks good. We're at 53.1. Even though it's slow, it's on a decline. And our positivity continues to remain stable. We've been below 5% since about the mid part of December. Our hospitalizations are stabilizing, continuing to decrease. Again, we want to see that trend. As long as we maintain those prevention strategies, we'll continue to see this go down as we are getting vaccine out into the community. This is that reproductive number that I told you I would show you a graph on. So you can see that we are below this dotted line. That indicates decreasing cases across the state. When we're above the line, we have increasing cases. So we just need to continue to maintain, again, the strategies that we're maintaining now. This is the transmission control number. You can see that we've gone up and down throughout the disease progression, but we've stayed pretty consistently around this number since about the middle part of November. This is one of the success stories as to why Colorado has done so much better than other states, especially around those holidays, because we were keeping our transmission control high. was allowing us to keep our numbers of new infections low. And when you look at numbers from Colorado compared to other states during the same time period, Colorado did significantly better. One of the reasons for that is Colorado's masking percentage is around 75%, where the average in the US is around 50. So we're doing the right things and we just need to keep it up. The current trajectory, the main point here is with the current trajectory that we're on right now, we're going to continue to see a decline and we'll be back to where we were around at our lowest peak in the summertime by the end of March. We just need to make sure that we continue to focus on these strategies. That will increase if we have major changes in variants, and I'm going to show you some modeling on that. Or if we stop using those prevention strategies, then we can expect to see this happen much, much more slowly. This is the modeling from the Colorado School of Public Health that I wanted to talk about. The key point here is transmission control does make a significant difference. I want you to focus just on the dotted lines here, and I'll point to the worst case scenario and the best case scenario. On the top, this is total active hospitalizations. And you can see on this top dotted line, that is, I know it's hard to tell by looking at this, but that's 60% transmission control. So in a 60% transmission control scenario, and there's multiple factors in this, like B117 is at 50% of our total infections in mid-March, and then 95% of our total infections in mid-May. But the bottom line is, under those scenarios, what makes a difference is continued transmission control. So if we drop transmission control, we see these numbers go up a lot. We also see cumulative deaths go up a lot. So look at the difference between this line right here at 60% versus this line at the bottom here that is basically flatlined with that very bottom line. If we keep our transmission control where it is now at 80% or 83%, then we barely see changes in cases. And that's the main message I want to get across to everyone, is it's really important as vaccine is getting out into our community to continue to mask and social distance and make sure that we're following the prevention strategies that have taken us so far. We're getting to the light at the end of the tunnel, and we want to make sure we're focusing on it for the next few months here as we get vaccine out into the community. And then masks, again, make a significant difference. The purple line is mask effectiveness in daily infections and daily deaths. You can see that even with vaccine getting out into the community, masks can make a significant difference in reducing deaths and infections. So just want to, again, emphasize the importance of masks. This is just a repeat of some of the things you've already heard me say. We're at 1 in 236. We'll get a new projection this week in terms of the number of infections that we see at the state. This will likely get a little bit better because they are projecting off the previous 2 weeks, which is why this was last updated on 2/8. And one of the most important things to remember is that we need people to still go get tested. Testing is free. Most people that have the disease aren't even aware that they have the disease, and the state is running tests on the variant to determine if the variant is in Colorado based on the tests that are getting submitted to the state. So it's important for people, both because we want them to know if they have the disease and because we want to continue our surveillance of the disease throughout Colorado to continue to get tested. You don't have to be symptomatic. The testing is free. You can go to Boulder County Public Health, COVID-19, click on the testing link, and it'll provide you all the information you need to find out where and when to get tested. Like I said, it's preventable. If we can keep up this great work through these next several months, we are going to be in great shape in Colorado. We'll be moving to a summer that's more normalized than we've had in the last year. And it's because of the great work that all of you are doing. And the last thing I'll say is if you haven't done it yet, go to addyourphone.com. It'll put an app on your phone. It will tell you if you've been exposed to somebody who's been positive and give you instructions for what to do from that point. And I will stop there, and I believe I'm turning it over to Chris Campbell, who's going to talk about everybody's favorite subject, which is vaccinations.
Thank you, Jeff. And hello, community members. It's always a pleasure to see you all and have the opportunity to present to you. Let me be going through an update again today. Let me just share my screen here. It'll take just a moment. Okay. Wonderful. So again, my name is Chris Campbell. I'm the emergency manager with Boulder County Public Health. I've been working with simply remarkable team of community members and staff in this unprecedented mass vaccination campaign, and just wanted to share some updates with you. I wanted to just remind community members of the statewide vaccination distribution phases. A couple points on this for community members to remember. This is one that the governor's office really is driving. Boulder County Public Health provides input as much as possible, but this really is when you see changes, those come directly from the governor's office, and we really have to stick to this phasing. I want to talk a little bit and take a step back and just talk about our overall vaccination strategy to remind community members. So we have a simply incredible provider structure that we've created. This is all the hospitals in our community, the federally qualified health centers, Clinic and Salud, pharmacy partners like King Soopers and Safeway, CU Boulder, other partners out there like Hope Light Clinic. They have really been doing remarkable work. You'll see some of those numbers. And they, should they see enough vaccine, have significant capacity to help vaccinate community members. That capacity is about 22 to 25,000 vaccines on a weekly basis. We are still only regularly seeing about 7,000 to 8,000 vaccines coming into Boulder County on a weekly basis. Again, we have a great structure in place. We'll remind community members to continue to access our website on how to sign up with those providers. The second part of our strategy are the health equity strategies you've heard us talk about, and I'm going to focus on and talk about that a little bit later in the presentation. What we do know is there are barriers to access for a number of community members, and we're working on grassroots, community-driven strategies there that we're already starting to implement based on feedback from the community, and I'll talk a bit more about that. And third, we are ensuring, should we see a large amount of vaccine in the county, that there's all different strategies available, and one is larger mass vaccination sites. For example, likely at the Boulder County Fairgrounds, there could be a larger site because that has great capacity. So this strategy would allow us to do an additional 15,000 vaccines on a weekly basis with some sites across Boulder County. So we are continuing to build the structure to provide vaccines for community members and making great progress. Looking at the phasing, so we continue to work through phase 1B1. There's about a group of about 1,500 medium risk healthcare workers and COVID response personnel, some other workers that we're vaccinating. That number of 70 plus community members is down to about 7,000 community members. So good progress there, and still a little bit of work to do. We know we still get feedback from community members that are 70 plus that they still are trying to get vaccinated. As soon as we hear that feedback, oftentimes a couple days later, that opportunity comes up for them. So we encourage you to continue to work with the providers out there to get vaccinated. In that phase 1B2, early childhood providers, private educators with the school districts and with the private schools are getting vaccinated, along with our providers are starting to move in and start to vaccinate community members that are ages 65 to 69. Just to address the next phase, many of you have heard from the governor that this phase of community members in this phase could potentially be eligible as early as March 5th. We're still waiting on additional guidance there. We're not sure if that is going to be the date. I know that, and I would encourage community members, believe the governor is having a press conference this Friday with additional information. We've had lots of questions from businesses, for example, or that work in manufacturing, for example. I would say that our messaging is right now is it does look like, because that group is so big, that we're just going to need to leverage that existing provider structure and encourage those businesses to work, to encourage their employees to access that current structure. And that information is on our website with all the providers that are currently providing vaccine. And another message for community members is we are, just because you become eligible on March 5th, does not guarantee you'll have a vaccine that day. As you see, we're still working through phase 1B1 with community members that are 70 plus. Those community members are not going to be left behind. We will continue to work to get those community members vaccinated. It's going to take patience. We still have inadequate vaccine coming to the county, and we still, we still have to work through these phases diligently and equitably. Just to discuss the numbers, though, for community members, we total number of community members that have received at least one dose of vaccine is really starting to move up, and exciting to see. About 50,000 community members. Most importantly, community members with that full course of vaccine is 25,000. So again, this is something again that ultimately is going to end this pandemic. As many folks that make that informed and wise decision to get vaccinated as possible is really going to help out. And our providers have worked really hard to continue to provide vaccine to eligible community members. Just digging into those numbers just a little bit more, with our 70 plus community members, we're almost about 80% of those community members having at least one vaccine. And I again would say, I know that means there's still about 20% or 7,000 community members that still potentially could access vaccine. We haven't forgotten about you. Please work with us as providers, all the providers, to access vaccine. It's the 65 to 69-year-old community members. That number is going up as well. So about 32% of Boulder County community members that are ages 65 to 69 have been vaccinated. Relative to the metro region for our 70 plus community members, we continue to make good progress. Just like to show this to show that Boulder County is continuing to work hard and is really leading the way there in terms of getting access to vaccine for community members that are 70 or older. And we just want to dig a little bit further. You're going to hear a lot from us about vaccination disparities and really those, our health equity and racial equity strategies that we're working on. And let me just go to the next slide here. Data is informing this decision, so community members know, and we are tracking, where we have gaps in access to vaccine. We know that we have disparities among vaccination by both income and geography, and so community members or locations in East Boulder County, Southeast and Northeast Boulder County, along with some of the mountain communities, we know there are some gaps to accessing vaccine, and our strategies that we're starting to implement are really focused on these areas. Just a couple important points to remind community members of. Our vaccine equity strategies really do rely on trust in the vaccine and informed decision making. And we're working really hard on that. And in fact, our community forums in the future, we'll be bringing a town hall style approach to that to really inform community members about the vaccine, answer all the questions they have about the current vaccine candidates. Many might know that additional candidate, the Johnson & Johnson vaccine, likely will see emergency use authorization even as early as this weekend. So we have information to share about that as we learn it as well. And we're excited to have yet another vaccine available to Boulder County community members. So we are really focused on getting this information out in an appropriate way. And just another point to mention is shared leadership. So we really have brought in a diverse group to inform this planning, these equity strategies, and really sharing the decision-making, for example, locations of where we're going to do community-based clinics are being driven by cultural brokers, community ambassadors, and community members about where those best should land. And we're also looking at resources for these strategies. It takes a lot of community members to make these happen. It quite honestly takes money and budgetary needs. So we're working through those as well. I know we had some questions that have come in to public health about the different types of clinics we're looking at with this equity strategy. There was some information in the newspapers about mobile clinics. This is a great option for us. These are going to be smaller clinics, likely smaller than 250 community members, but even as small as 50 community members with these mobile clinics. They are focused really on community members that have limited mobility, that are in independent living situations and more congregate living situations, and homebound individuals, and also our mound communities where we know there's community members in these scenarios. Some questions we've had from community members, there's no way to sign up for these currently. We have started with the independent living, some independent living communities in Boulder County, and this will expand. And you'll hear more from us about how to access these clinics. They really are driven by the data. They're driven by community members. We're also working with the Boulder County Area Agency on Aging to inform these sites and homebound individuals, Meals on Wheels in Boulder County, all the Meals on Wheels partners, to really inform us on homebound individuals and other individuals with limited mobility. Our community clinics we're working through, the strategy hasn't quite been implemented. We are identifying sites throughout the county. These are going to be longer term fixed sites where community members inform us where those should be located. They're going to be throughout the county. We're making good progress on those. Those are going to be bigger clinics that community members can access. And we'll have more information on that in the coming weeks. These really are focused on racial and ethnic minorities. They'll be in our mound communities. These are community members that we've talked about in the past that have been impacted by systemic racism, systemic issues, lack of access to healthcare. And so we really are, we're really making good progress on the strategy, but it's taking us a little time to do it well and do it right. And then our traditional clinics, we really are encouraging community members that have good access to and can navigate the systems out there to go to our website and access those providers I discussed. So community members that are 65 plus right now, they have transportation. Please sign up with the providers. You will hear from them. It might take a little bit of time. You will hear from them, and we encourage you to check back with them, and you will have an opportunity to be vaccinated. Again, this is a long-term approach, so you're going to hear us discuss this many times. The education component is critical right now. We want to continue to provide additional information about the vaccines, the safety of the vaccines, why they are having an impact on ending this pandemic and the situation we're in. But we know there's root causes for folks to mistrust these vaccines, including political influence, concerns about long-term side effects. And we want to have a good conversation and an informed conversation about that with community members. We continue to do town halls. We've done those in several languages. We have an incredible team continue to work on that. We know, we had concerns from our early childhood provider community, and we had a great town hall with them to talk about the vaccine, the concerns about that, how safe the vaccine is, why it's important to not only protect you, but to protect your family members and ultimately community members. So you will see more of these town halls from us, and we do encourage you, if it's something you're interested in, you can reach out to Boulder County Public Health. There is potential we could hold a town hall for groups, so please reach out to us. Just some key messages, and you might have heard these, and I would ask the community to really help us with these key messages. We know these vaccines are safe. They must be proven to be safe and effective before they're given to people. It was a rigorous process to evaluate them. In this COVID vaccine, these COVID vaccines we have are safe. Getting vaccinated is going to ultimately end the pandemic and get us back to some of the things we really all enjoy doing. So we're excited about that, and we'll share some more information on that in the future. Again, we know that vaccines not only protect us personally, they protect our friends, they protect our family, and ultimately community members. We need to work together as a community to get to vaccinate as many community members as possible. So we ask you to help share these messages. When you hear from friends, colleagues, please direct them to good information. There's information on Boulder County's website, the state health department's website, that really talk about these vaccines and how remarkably effective they've been so far. I just wanted to share a little bit about how our equity strategy is structured and coming together, and this is a work in progress, but we continue to make good progress. We have trained community ambassadors that are actually funded. They're trained in vaccine safety and effectiveness, and they are really starting to reach out and connect community members to vaccine clinics, either our mobile clinics or our community-based clinics when those are up and running. So these are, again, we'll talk about some of the affiliations they have, but they're incredible community members that really are in touch with the needs in the community, the barriers that community members are seeing, and informing our planning from that community level. And community influencers, this is a very large group, and I'll talk about what that is, but these are really getting the word out for us and connecting to our community ambassadors. I'll share what that group looks like on the next slide. So these group of community influencers, just to dig in that a little bit more, they really are trusted community messengers. They include diverse community members that are connected to schools, cultural brokers, bilingual community. This also includes, for example, our Family Resource Center partners in the community who have done remarkable work and continue to do so with community members. So we just wanted to share this a little bit and really focus on the fact this is community driven. And we are organizing as a group, what's called a VEC group, which is our Vaccine Education Coordinating Committee. And that group is really informing all of these strategies. That includes groups like the NAACP, the Peak-to-Peak Human Services Alliance, Out Boulder, and others. That group is growing. We're organizing this, so there might be a few we left out there. And then you'll see some of the other groups we're working with, like El Paso, Intercambio, El Centro Amistad, El Comité, Second Baptist Church. Again, very much a diverse group and really informing our planning. So I just want to remind community members about the information they can receive. General questions can go to the state vaccine call center. We want to remind community members about our Boulder County Public Health call center. if there are community members that are struggling with access, technology access, they are able to call our call center, and we can work with you, to look at vaccine provider sites and potentially get signed up, working with our call center. So I wanted to remind community members of that. The number's on there, and that's also on our websites. Our websites are in both English and Spanish. We have lots of information on our vaccine strategy and the providers out there. And again, it's going to take all of us as community members to end this pandemic. So I just want to thank everyone that's in the meeting today, and we'd be happy to answer questions.
Thank you, Chris. Lots of good information about vaccines there. We are now at the Q&A portion of our meeting. I'll try this again. Thanks, everybody. Q&A time now. You'll see on the bottom of the screen, it says Q&A. If you click on that, type your question in, we will read it out loud for you. We ask that you keep your questions short so that we can get to as many as possible. We know that all of our speakers today are coming from a place of respect. We ask that you please do the same. We're going to be focusing on vaccine questions, of course, today. If you have any other questions that we don't get to, you can send them in an email to healthinfo@bouldercounty.org. And also, along with the speakers, Jeff and Chris, we'll have two more people answering questions. One is Dr. Chris Urbina, the Boulder County Medical Officer for Public Health, and Kate Haywood with the Boulder County Attorney's Office. So let's get to the questions. I'm going to start with an easy one for you, Chris. If I get vaccinated in another county, will I show up in Boulder County vaccination numbers?
Yeah, thank you for the question. You will show up in the Boulder County vaccination numbers. That's how that data is being collected.
Thank you. Jeff, here's one for you. How many people in Colorado are using the notification app, the one that goes on your cell phone?
Thanks for that question. As of the end of December, it was more than 1.4 million people. So that number is probably higher right now. I know the state's been marketing that quite a bit. And obviously, the more people that use it, the more infections it can prevent.
Okay, thank you, Jeff. Dr. Urbina, I've got a question for you here. Once the Johnson & Johnson vaccine is approved and the general public is allowed to start getting vaccines, would you suggest that younger individuals choose the Johnson & Johnson vaccine, which looks like it may have lower effectiveness, and save the other two, Moderna and Pfizer, for older people? Should we get whatever we can? How does that vaccine choice thing work once we get there?
Thank you for the question. I think it's too early to tell the answer to this because the J&J Johnson & Johnson vaccine hasn't been approved yet. So we're waiting to see both the safety and the effectiveness profile, as well as the age groups that were studied. Once we get that information, I think we'll be better able to make that decision. And because it will be a one-dose vaccine. So I think we need more information first. I would stick right at this point with the current recommendations and phases that Chris Campbell talked about earlier. Once you become eligible, I would not wait for another vaccine. Get the one that you are eligible for now. We know this vaccine, as Chris Campbell talked about earlier, is safe and effective. It's like having a piece of pie. Doesn't matter what flavor it is. If you get offered pie, take the pie. And so in this case, take the vaccine. I wouldn't wait for the next dose of vaccines.
Thank you, Dr. Urbina. Chris, I do have a question here about the phases, the prioritizations. Basically, it asks, will individuals with a chronic neurological condition, or actually any condition, be prioritized in the general population? Many other states are doing this. Why aren't we prioritizing the same things as other states are? And I know this really is a state of Colorado question, but what can you do what can you tell us about that?
Thank you for the question. Well, it's a great question. Yeah, I would say, one, it is very much a state of Colorado decision right now, a governor's office decision, and that's what we're going by. We provide feedback all the time based on these forms we have. So we take this feedback, we hear from community members, the science and the data, and share that with our state partners, with the governor's office, and then we continue to follow the phasing. I would say, in this next phase, 1B3, we will have, there is a prioritization, at least as it's written now, for community members with 2 or more high-risk conditions, and they're listed in that phasing plan. So I'd ask community members to go check that out. You'll simply likely just have to work with the provider and just do a simple attestation saying you have those conditions, and then you'll be vaccinated.
Thank you, Chris. This might be for Jeff, it might be for Chris. Do we think that companies will be allowed to require that employees get vaccinated? Do we have any information on that?
So we are not requiring that anyone get vaccinated. We are encouraging it, obviously. I'm not a lawyer, so I don't know, unless Kate has a sense here, about companies who make their own choices to require vaccinations of their employees.
Thank you, Jeff. CDPHE does have this information located on its vaccine frequently asked questions page, and I will just read that real briefly. So the question on the page is, can public and private sector employers mandate employees obtain a vaccine authorized by the FDA? And the answer that CDPHE provides is that employers may be able to require COVID-19 vaccination for in-person work for their employees, but an employee may be entitled to an exemption through the ADA and Civil Rights Act of 1964. The state of Colorado is not currently pursuing any mandates. The guidance webpage also includes a link to additional information on the website of the Equal Opportunity Commission, so I recommend you check that out if you'd like more information.
Thank you. Okay, Chris, I've got a number of questions about phase 1B.3. I think we all do. One of the questions is basically, do we expect the governor to split up 1B3 into any smaller groups? It's a big group. Do we think it's going to stay like it is? Or do we have to wait till Friday to find out what's coming?
Thank you, and these are great questions. We really have we have no guidance on this yet. We have asked to see if there is going to be any changes, any further definitions in these areas. We haven't seen those yet, and there is a chance, as we know, it is a very large group, and it's going to be challenging as it rolls out. So we, again, we're in that same phase as community members, kind of understanding this. Again, what we want to do on our end is just continue to provide clear and transparent communications with community members around this, and build that infrastructure to ensure folks can access vaccines. I will remind community members again, just because there's an announcement made or your phase is available on March 5th, again, it might be challenging to be able to access a vaccine on that date. You ultimately will be able to. I've talked with community members that really struggled. It was frustrating for them. We were trying to work through that, and then they did have an opportunity to get vaccinated. They got that email, they got that phone call that said, you have appointments available. So, it's really challenging to be patient. I will say again, we do anticipate more and more vaccine is going to become available. We're excited about that. So these next couple of months, next month and a half is going to be challenging with that vaccine supply. I think we're going to have a different community conversation here where we're going to have vaccine, and folks, we're just going to be working on getting that out to as many people as possible.
Great, Chris. I'm going to keep you there for another question here. Here's a simple one. Do we know how many people are in 1B.3 in the state of Colorado?
I don't have that number. We can follow up and find that. I think the challenge has been, again, just really knowing who technically falls in some of those very broad categories. So we haven't been able to go and really go by worker category to figure out those numbers. It was easier when you were talking about age groups, for example. We could use the census data that we have. However, we don't have a good census yet. I know there's some general numbers put out there from the state when this was first announced. So I'll have to go back and look at those, but I don't know those numbers for Boulder County currently.
Okay, thanks, Chris. Dr. Urbina, I've got one here for you. That's about vaccine efficiency, efficacy. Given that the Pfizer and Moderna vaccines are about 92% effective after the first 2 weeks of the first dose, not sure if that's accurate, but anyway, can we postpone second doses so that more people will have access to the first dose?
Thank you for the question. You know, this is a national debate that's going on, and actually there was a debate in the United Kingdom as well. Because the Advisory Committee on Immunization Practices, that's the group of experts on the national level that advise us for all vaccines, measles, mumps, and rubella, pertussis, influenza. They're recommending in the United States to continue the 2 doses of vaccine because that increases the greatest amount of effectiveness in preventing you from getting the moderate to severe infection or complications from the infection, as well as decreases the likelihood of actually getting the infection in general. So we're sticking with that because that's what the US ACIP has recommended. We're, as Chris Campbell stated earlier, we are very hopeful that with the new administration, we're going to see a significant number of increasing both Moderna and Pfizer vaccines, so that we'll have enough, hopefully, as that 1B3 population continues to be added, we'll have enough vaccine. And as the Johnson & Johnson vaccine is being available, hopefully approved in the next week or so, we will have enough vaccine for everyone. So I think just be patient with us. And I recognize this is very frustrating for people, as Chris has answered this question at least 100 times that I'm aware of, that it is difficult when you have people that are eligible and ready to get the vaccine, and we don't have the vaccine yet. So please be patient with us. And as Jeff said it earlier, I just want to emphasize that regardless if it's our current strain of virus variant now or future variants, still we need to wear masks, wash our hands, do physical distancing, because that's a very effective method of stopping the transmission of the virus while we wait to get vaccinated. And when we do all of those things, as Chris talked about earlier, we'll be much farther ahead in terms of reducing the amount of virus in our community. So we have to practice all of these things while we wait our turn for getting the vaccines.
Thank you, Dr. Urbina. Chris Campbell, here's one from you, for you. I heard from a resident today that her second dose Moderna was not available today. Can you talk, we know that there was some limit in the supply of vaccines last week due to the bad weather. Can you talk about supply, second doses, how all that is looking in Boulder County?
Yeah, thanks, Mike. And make sure I'm highlighted here. There we go. Yeah, that's absolutely right. We did see a disruption because of the weather that hit down south. And there were second dose clinics canceled this week in the county with a lot of our providers. One thing, and Dr. Bina can also speak to this, we know that there's a time window after, for example, if it's a 23 or 28 days, it doesn't have to be exactly on those days. That's what is preferred. However, you have time subsequent of those days for several weeks, actually, to get vaccinated, and it'll be just as highly effective. So no worries there. We do know now that vaccine is coming in. It was just delayed. Our providers were all made aware of that. So likely, hopefully we won't see any additional cancellations of those second dose clinics, but it did happen. And again, I would just, for community members that are in that situation, things just continue to work with the provider. and you'll get vaccinated with that second dose, and things will be good to go for you.
Thank you, Chris.
I would just add to that, the CDC, Center for Disease Control, CDC, says that you can get up to 6 weeks after your first dose to be still effective. So you have some time. For the Pfizer, that would be 3 weeks. For the Moderna vaccine, that would be 2 weeks. So you have a window. And as one of the earlier questions said, that first dose will protect you some, but we still want you to get that second dose. So please check back with your provider.
Thank you, Dr. Urbina. This question might be either for Chris Campbell or Chris Urbina. Is there any way to minimize the side effects of second doses in advance of getting vaccine?
Yeah, I'll take that, Campbell. There is some evidence that taking prophylactic ibuprofen or acetaminophen does reduce the effectiveness of vaccine. There was a couple studies in children that showed that ibuprofen does do that. So we're not recommending at all to take prophylactic acetaminophen or ibuprofen, but it is okay to take those after you get the vaccine when you have significant side effects. And I think Campbell has talked about this at other events, is that you have to expect side effects. You may have a sore arm, you may have a little swelling, you may feel achy, you may be tired, have a headache, may have a little fever. So it is okay. Those are expected side effects. So if you want to just drink more fluids, use a cold compress on your arm, and then if those effects get a little worse, they usually last from 24 to 48 hours afterwards. If they get worse, then it's okay to take acetaminophen and ibuprofen, but try not to take it prophylactically.
Thank you, Dr. Urbina. This one's for Chris Campbell. Do we know what percentage of Boulder County teachers have been vaccinated? Do you have any update on where the 2 school districts are?
Great question. I do not have those numbers. What I do know is we've heard from our providers, Boulder Community Health, for example, who's working with Boulder Valley School District. They had clinics the last 2 weekends where they vaccinated 1,000 of the educators, which has been wonderful. So about 2,000 of those educators have been vaccinated. Yeah, I know the numbers look great for San Fernando Valley School District as well, along with the private schools and their early childhood providers. But I don't have the kind of percentages today.
Thank you, Chris. Okay, Chris, a few more 1B.3 questions. Basically, they're asking what kind of proof will you need if you've got 2 or more health conditions when we get to that phase? And related to that, are we worried about people not having 2 conditions and trying to jump the line? What can we do about that situation?
Yeah, I think another great question from the community. This is a challenging one, but again, our goal and our goal as a community is getting as many people vaccinated as possible. You know, we don't want to provide any barriers, and it is really challenging to verify underlying conditions. So we will rely on community members being honest. They'll just self-attest that they have those conditions, and they'll be eligible to be vaccinated. It takes a community, and so we need to be patient. If I think it is very much the minority of community members that are taking that route and maybe jumping the line, and I know the vast majority of community members are waiting their turn.
Chris, this may be for Dr. Urbina, I believe. Can you talk overall what we know about percent immunity after both the first and second doses? How long it takes for everything to kick in? When should you feel like you are immunized after you've had your second dose?
Thank you for the question. You know, I appreciate the questions from the community. We want to spread the information, not the infection. So I'm glad you're here, and hopefully you'll learn something from this forum and pass on this information to others. Currently, we think after the first dose of Moderna and Pfizer, It's anywhere between I've seen studies as 80%, as high as 91%. So it's variable. Everybody is slightly different in how they respond to the first dose. Now, after the second dose, Pfizer is 3 weeks, with Moderna it's 4 weeks, you can expect anywhere between 94 to 95% effective at preventing moderate to severe disease and likely prevent you from getting the infection. So that's a good thing. Now, everybody is slightly different, and so that's why we're still recommending wearing masks and physical distancing and washing your hands, because those are all prevention strategies that we should continue to implement. Now, because the vaccines take about 2 weeks to actually produce an immune response, that you're really not fully vaccinated until 2 weeks after your second dose. So just keep that in mind. There are some changes in quarantine that we're rolling out from the CDC. Expect to see more information coming regarding changes at the national level, as well as changes in Colorado regarding quarantine once you've been fully vaccinated.
Thank you, Dr. Urbina. I've got one more that I think probably is in your court. Do you feel it will be safe to fly after receiving both vaccines?
I could make a joke here, but I won't. The idea about flying, obviously, if you look at the CDC's Center for Disease Control's website, they're giving you recommendations about reducing flying, using all the prevention strategies that we've talked about so far, of limiting your contact with people, wearing a mask, doing all the things that we've talked about, and getting vaccinated. Now, clearly, all of those factors reduce your spread of the infection. So I think it's a judgment call on your, based on what you think your risks are, whether or not you should consider flying. Obviously, if you're in the high risk group, and you have certain conditions, then I think you should follow those guidelines, talk to your physician, look at those CDC guidelines, and make your own decision. Now, as I talked about earlier to the previous question, we're going to hear more from the Center for Disease Control as well as the state health department to talk about the changes in quarantine. But I think in the interim, until we actually remember, children don't have access yet to the vaccine. So we're not going to have our population fully vaccinated. So it's going to take a while to get through all the phases that Chris Campbell talked about. So in that interim, still use these prevention strategies and do some reasonable thinking or sensible thinking about whether or not you as a higher risk person should avoid flying or traveling. But you should, of course, avoid large social gatherings, because that's clearly where we think that the disease is spread, and actually you don't know who's been vaccinated or not. So again, we're encouraging you to take precautions. You can make a difference if you use all those prevention strategies while we continue to get more vaccine and protect more and more people.
Thank you, Dr. Urbina. And with that, we're going to wrap up. I want to thank everyone for joining us today. We want to let you all know that we are going to a bi-weekly schedule, or every 2 weeks going forward. The next community update will be on March 10th, when we will talk about information and education about the vaccine, including safety of the vaccine and equitable distribution for the residents of Boulder County. To keep updated until then, you can visit our website at bouldercountycovid19.org, or you can just Google COVID Boulder County. It'll bring you right there. If you have any additional questions, we ask that you please send them to healthinfo@bouldercounty.org. Again, thanks for